Good morning, everyone, and thank you for joining us today in Medicine Hat. My name is Michaela Glasgow, and I'm the MLA for Brooks Medicine Hat, and it is my pleasure to be with you today. On behalf of the beautiful city of Medicine Hat and the constituents of Brooks Medicine Hat, I want to extend a very warm welcome to all of the guests who have made the journey down south here today to be with us. Today is a very good day because we are going to be bringing news that will support patients here at St. Joseph's Home Carmel Hospital, as well as Albertans across the province who require emergency medical services. I am very proud to welcome my colleague, Minister Tyler Shandro, Minister of Health. Thank you, Minister, for your tireless commitment to improving healthcare services for the good people of Brooks Medicine Hat and for southeastern Alberta. I know that my constituents really appreciate this work, as your work is truly appreciated. Also joining us today is Darren Sandbeck, the Chief Paramedic and Senior Provincial Director of Emergency Medical Services with Alberta Health Services. So welcome, Darren, and thank you to all of the paramedics who are there for us every day and all of the frontline workers who have been getting us through the past 16 months. And from Covenant Health, I would like to thank Sherry Murphy, Senior Operating Officer, Rural Services, for joining us all here today. St. Joseph's and the staff are very much loved and appreciated in the community. And I know from personal experience with family members and loved ones that St. Joseph's is a real pillar in our community and does an incredible amount of work to make sure that we provide choices to people in their last days and to take care of them when they need it the most. So I just want to say welcome to everyone and thank you so much for being here. I know for myself, this is a great joy to be able to have the minister here. Often in Southern Alberta, we feel as though we may not always be seen, but I think the minister being down here today, as well as the commitment from the province, I know there's some pretty exciting things coming up and I don't want to spoil the punchline, so I'm going to turn it over to you, Minister Shandro.
Well, thank you very much, Michaela. And by the way, this is the most, I think, in 2 years in being a politician, the most beautiful backdrop I've ever spoken in front of. This is absolutely amazing. I was hearing a little bit of the story about this tree. The sign says 1906, but I guess the sisters first came here in 1904 and insist on this tree was actually here before they even came. So this tree might have been around since the 1800s, and just what a beautiful backdrop for this announcement. And so thank you, Michaela, though, for the introduction and for the great work on behalf of Brooks Medicine Hat. And good morning, everyone. And thank you and a warm welcome to our guests. As Michaela said, we have both Darren and Shelley here who will be speaking in a moment. And as any paramedic can tell you, a given patient may need an ambulance, but doesn't always need to go to a hospital emergency department. Sometimes the right care for that patient is available at another health facility, one that's closer, and that can see the patient more quickly, more soon. And that's why I'm pleased to announce that Albertans can now be transported by paramedics to another healthcare location when a hospital emergency department is not the level of care that they need. Now, this change means that paramedics can treat and then transport patients to a care facility, such as a hospice or community care clinic, that's equipped to help with events that are urgent but not life-threatening. For a number of years now, we've had a recurring problem with paramedics lining up in emergency departments waiting to transfer care of their patients. And it's not the right use of their skills as paramedics, and it's not the best care for the patient. EMS and the hospitals do their best to mitigate it with practices aimed at getting crews back out on the road faster. But until recently, at busy times, they had to just wait because they weren't allowed to go anywhere else. Now, EMS has been dealing with these delays for years, and they've been saying for years that sending every single patient to emergency doesn't make sense, that some patients can and should be able to go somewhere else. Well, now they can. And this includes Albertans in and around Medicine Hat who would be better served by care from Carmel Hospice at St. Joseph's Home. They can now be transported by ambulance directly here when appropriate. By the end of 2021, paramedics will be able to, and by the way, just because Michaela mentioned this as well, when she mentioned that Darren's going to be speaking later on. Darren, through you to all paramedics, we know not all paramedics work for AHS, but through you to all the paramedics of the province, thank you for the amazing work that they do. Too often, paramedics not seen as being the healthcare workers that they are. And this government, just to make it very clear, does see paramedics as being important healthcare providers throughout the province. And so by the end of 2021, as I was saying, paramedics will be able to treat and transport patients to 10 healthcare locations across the province other than an emergency department. And this is just phase one of this work. Over the next 2.5 years, we'll look at giving paramedics the ability to transport patients to primary care providers and other non-urgent medical facilities. Now, this means that paramedics and the EMS system overall has more options to help them do their job to get each patient to the right care at the right time. And it's one more step in a constant process of evolution to make better use of the resources in the system by coordinating them better. And it will reduce delays for some patients, which means that they get better access to care. It will also mean fewer delays for paramedics, so EMS can make better use of its resources, and diverting some patients from emergency departments means a bit less burden on those emergency departments. But to be clear, this isn't about cutting visits to emergency or saving money for EMS. It's about getting every patient to the right care. And that's the one and only goal for EMS, always. We'll keep working to help them meet that goal as part of our commitment to strengthen our healthcare system in every community across this province. And it's wonderful to see some of those communities this week, starting here in Medicine Hat. And this afternoon, I'm headed with Emily Glasgow to Bassano and Brooks. And so thank you, Michaela, for your warm welcome. And thank you, Shelley, and all of the dedicated staff at Covenant Health for welcoming us here to St. Joseph's and providing world-class care for Albertans. I'll now turn the podium over to Darren Sandbeck, the Chief Paramedic of AHS. Darren.
Thank you. Thank you, Minister, and thank you for your kind words and for your support of our paramedics who are out there every day working tirelessly to support Albertans. This option to transport more Albertans to alternate care sites is something that EMS has been working closely with government on for some time now. And while we've been able to utilize some limited alternate transport destinations for some time, this plan allows us to expand on a program that we know firsthand is working. And it also delivers a substantial added benefit for some patients that they will not be out of pocket for transportation costs. We're very pleased that this expansion is now taking a substantial leap forward with these two phases that the Minister spoke of. This is truly an initiative that has the best outcome for patients at heart. Our paramedics know that sometimes a 911 call doesn't automatically mean the need for an emergency department visit. This announcement recognizes that often a patient needs can be best managed by a different facility or other pathways of care in their town, city, or rural area. Support on this initiative from the Alberta government allows us to transport patients where they can best be looked after, without adding unnecessary strain to our emergency departments or burdening patients on fixed incomes with additional financial costs. While some of these sites may not take a large number of EMS patients, from a patient care perspective, any movement to a site that is more appropriate will go a long way towards improving the healthcare system as a whole. At AHS EMS, we take pride in our work and in doing the best by Albertans. Being able to utilize more transport locations will be another way we can help patients stay closer to their homes and to their families, and to the medical professionals who know them and their histories. It can be a small but very important way we can help keep families connected. Finally, this initiative to take a patient elsewhere when a hospital is not required will also have the added benefit of getting our tireless paramedics back to the job of patient care faster, which in turn will further alleviate stress on our hospital emergency departments, remaining able to respond to emergency needs across this province. Thank you.
Good morning, everyone. My name is Shelley Murphy, and I'm Senior Operating Officer for Rural Health Services for Covenant Health. And on behalf of Covenant Health, I would like to welcome you to St. Joseph's Home. We are truly blessed to work with Alberta Health Services as part of an integrated health system in Alberta. And in caring together, we all ensure patients and residents experience seamless care. We are so grateful to the Government of Alberta for today's announcement. St. Joseph's Home is also home to Carmel Hospice, and those we serve here will positively be impacted by the expansion of services. As Darren said, they won't need to go to the emergency department. They can come straight here, and we know the benefits that that has. Carmel Hospice provides care to palliative patients with a focus on achieving comfort. It is fitting that we stand here underneath the heritage elm tree, one of 7 heritage trees in Medicine Hat, to make the announcement today. This tree has been here for our residents since 1906, and we continue to will continue to offer shade, tranquility, and watch over our residents. Palliative care is about giving people quality of life. Palliative care touches every aspect of a person and their family's life, and is available at any stage of life-limiting or serious illness. We treat not only the patient's physical symptoms, but we also tend to their emotional, psychological, and spiritual concerns. By expanding EMS services, the province will be supporting the vulnerable and often very frail patients requiring urgent and non-emergent care, with transportation and therefore providing direct access to support and care they need in their community. These changes will support our patients and their family and will provide an easier, the best transition into palliative care. I wish to extend a very heartfelt thank you to the Government of Alberta and Minister Shandro and Darren for all these changes that they have worked through, because they will make a difference for those we serve here today and into the future. Thank you very much.
So today we have media both in person and on the phone lines, and I'll ask our media in person to step up to the microphone to ask their question, and then we'll go to the media on the phone lines. Go ahead.
Hi, Minister. I was just wondering, a recent Helivac report came out, and there didn't seem to be a lot of good news for Halo Air Ambulance here in southeastern Alberta. Just wondering if you could touch on, why funding wasn't considered for Halo Air, but it was considered for STARS.
Sure. So, well, first of all, we're reviewing the HEMS report. HEMS, the helicopter EMS, the HEMS report that came out, we're reviewing that. I actually met with Halo before this announcement, so I went to go tour and see their new BK helicopter with Emily Glasgow. And Emily Glasgow has been a passionate advocate for Halo. And so being able to also meet some of the folks that are up in the helicopter treating patients was helpful as well. We've made a commitment to being able to listen to the various folks affected by the helicopter EMS report. Well, I won't speak for Halo, but I think there's one of the recommendations in particular that they want us to be able to they want to provide further feedback to us about. Many of the recommendations aren't related to funding, but about trying to make sure that the system has a certain level of standards, that we're improving the system. I'm looking forward to understanding how that might be implemented, and when it comes to the funding decisions, being able to listen to both Halo and Hero. And as well as STARS and AHS to understand what the implications of that recommendation might be, and what the opportunities might be for us to have all the different partners in the system be able to work together. So before we make any decisions, we're going to finish that consultation, and that may not answer your question necessarily, but it's that we're going to continue to consult and listen before we decide which of the recommendations and how that would be implemented in the end.
Do you have a follow-up?
Sure.
Sorry, just in relation to your announcement here, there's just some reports about, EMS workers, particularly in Calgary, being overburdened and overworked just with, the pandemic-related calls and stuff. So how would this announcement help, given paramedics seem to be overburdened already with calls?
Sure. Well, a big part of that burden is also because so many of the resources right now are folks who have to stay with the patient in a hospital. So that means fewer folks on the street being able to respond to calls. So if we have more of our resources outside of our acute care facilities and back on the street, it means more resources being able to respond to calls. So this is phase one, as I said. Phase two would be how we look at other opportunities. We're also, though, working with AHS and being able to look at how else we can invest in our ground ambulance system and improve the ground ambulance system, improve not just a response time to the house, but also the turnaround time for a paramedic to get back on the street. And so this is one of the announcements that's going to be coming, and how we're working with AHS to improve the ground ambulance system for all of our paramedics, but also for patients. Thank you.
Thank you. I'll go now to the phone lines. Operator, please put through the first caller.
Michelle Belfontaine, CBC. Hi, Minister. My first question is, how were these locations chosen? Why were they chosen, I guess? Why these ones?
Well, sure, and that might be a question I defer to Darren on, but this is phase one. So what we're looking at first is understanding resources throughout the province where we have an ability to, when it isn't a life-threatening situation, is an urgent situation, but not life-threatening, there might be other resources to help us in a certain community, like here at St. Joseph's. But Darren, for the recommendation for phase one of these locations.
Thank you for that question. The decision on these facilities for phase one was done through consultation with our EMS operations team and also in understanding what services these facilities are able to provide. So we need to recognize that, again, this is the first phase of this, and we're hopeful, as the minister spoke of, that there will be additional facilities that will be able to receive EMS patients, as well as other referral pathways that the minister spoke of, things like primary care networks and other pathways that we'll be able to utilize.
Michelle, do you have a follow-up question?
I do. So I'm just trying to understand how this would work exactly. So you are somebody, say a senior, who's having some kind of health incident where they have to call for an ambulance. So the ambulance shows up, and so there's an assessment done, I guess, right? And then there's a determination by the EMS staff where to take this patient. But what happens if you take this patient to this other center and then maybe perhaps some kind of other health incident happens? I'm just trying to understand how this would actually save time in the system.
Sure. So a couple of things, and maybe it also does begin with the work that we've done to being able to integrate dispatch into AHS. What we started in February of 2020 is having physicians in those dispatch centers. We have 3 of them that are operated by AHS throughout the province, and having physicians included in the dispatch decision, we can help provide clinical triage decisions. So a physician can also help the paramedics make some of those decisions about where the best resources might be for the patient. Sorry, we have. I hope that's not too loud with the. Is it too loud? Are you guys okay with the train noise? Okay. So that's the first thing, is that this is part of also being able to have further resources in our dispatch center and making the decisions, the clinical decisions about where a patient should and could be going. The second is, because you also asked, how does this make things quicker? If all patients have to be going to the few emergency departments that we might have in a community or even in a major urban, it just means that it's more difficult for the paramedic to wait until the patient is either discharged, or if they are ended up going into the hospital, making sure that there actually is a hospital bed either in the emergency department or in elsewhere in the hospital. And sometimes that wait, when everybody's going to just a few emergency departments that we have throughout the province, it's difficult for that paramedic to get back on the road. So if we have more opportunities for paramedics to have patients be seen, those opportunities for the paramedic also to get back on the street. Also, I'd say, because you were asking about process too, so process is still going to be the same for the patient's perspective. The patient's still going to call 911. The patient is still going to have the paramedic come to the house. The paramedic is still going to be able to make the clinical decisions that they make there at the scene, whether it's the patient's home or elsewhere. So the patient is going to see anything differently other than being able to have access to care more quickly for that patient. Darren, anything you would want to add to any of that?
No,
Okay.
you've covered that well, man.
Okay.
Operator, can you please put through our next question?
Duncan Kinney, progress report.
Hello, thanks for taking my question. I have paramedics texting me while this press conference is going on saying that they already transport to hospice, that they already transport to community care. These are paramedics who work in the cities. What's the substantial difference in this announcement between how paramedics already operate?
Darren, do you have an answer for the senator or a candidate?
Yes, thanks for the question. Our paramedics do transport in Calgary and Edmonton predominantly to a number of alternate transport destinations. That includes things like urgent care facilities and other types of facilities. What this announcement does is actually it does two things. One, it opens up that opportunity across the province to other community partners and other facilities within other communities to be able to transport to. And number two, as I spoke about, it reduces the financial burden to the patient. So it allows for coverage for those transports to now not be a burden to the patient any longer.
Duncan, do you have a follow-up question?
Yeah, so just to clarify, this announcement this is already happening in Edmonton and Calgary, and this is now being expanded to other communities outside of Edmonton and Calgary. And how specifically, just to clarify, if you could clarify that, and then this reduces the financial burden for the patient. So how? Is the patient simply not going to get a bill if they're not transported to a hospital? Is that the announcement that is contained within the announcement today?
Yeah, a big part of this was in the background is being able to change the agreement with the Blue Cross so that there's more coverage for the facilities that the patient can have the opportunity to be taken to. Correct. Thank you, Duncan.
Operator, could you please put through the next caller?
Catherine Grukowski, Alberta Today.
Thanks for taking my question. In the news release, it mentions performance metrics and data. I'm wondering, how are you going to be tracking this? Is there a specific wait time reduction or like the amount of time that you want to reduce paramedics, EMS staff staying at hospital? Like what and how are you going to be tracking with this?
Sure. Maybe I'm going to pass this one off to Darren as well. Maybe just talk about the current state of how what the metrics are and how they're tracked and what the goal is going forward. Darren?
Thank you for that question. So we measure what we call hospital offload times. We measure that on a daily basis in both Calgary, Edmonton, and the suburban sites, so the other 7 larger municipalities across the province. So we currently track that offload time, or the time that our paramedics are in hospital waiting to transfer care of a patient. So we continue to monitor that. And as I said in my comments, although the numbers we don't anticipate to be huge with this announcement, we believe that any of those patients that we're able to move away from the emergency department to another appropriate level of care, and as we move into phase 2 of this, into more of the referral pathways, that's when we believe we'll really begin to see the impact of this announcement and then what's coming in phase 2.
Catherine, do you have a follow-up?
Is there any cost savings or increase or any change in terms of the dollar amount with this initiative?
No, this isn't about savings and there's no increase either. This is just about making sure that with the resources that we have in the ground ambulance system, and as I said, there's more work to be done with AHS and how we improve the ground ambulance system. But for this announcement, there's no additional cost. This is just about making sure that patients have access to the care that they need more quickly. Thanks, Catherine.
Operator, could you please put through our next caller?
Mirna Jusic, Radio Canada.
Hi, thanks for taking my questions. It's for the Chief Paramedic, Darren Sandbeck. I want to talk about the pressure the paramedics are facing right now. We heard that in Calgary and Edmonton in particular during the heat wave, there's been some measures to delay non-urgent transfers. I'm wondering what that means exactly, if you could expand on that.
Yeah, thanks for the question. The EMS system through the recent heat wave has been and continues to be actually under significant pressure from a call volume perspective. One of our strategies to deal with that, as you mentioned, is to defer non-critical or non-urgent transports. So we move every day hundreds of patients between hospitals all across this province. And we do that in the metro centers in Calgary and Edmonton as well. And so what that strategy allows us to do is actually just delay that transfer to move that patient at a later time when the system is not so busy, and we're able to commit resources. So those resources that we would use to move that patient between facilities where they're completely safe, they're in a healthcare facility, we would then move them at a later time, and we would be able to then use that resource into the emergency side of our work, which has been very busy.
Myrna, do you have a follow-up question?
Yeah, sure. So is that something that's going to keep happening in the next few days? We heard concerns with people about staffing shortages. Is that something you're concerned about?
Sorry, was it staffing shortages you asked about?
Yes.
Yeah, thanks. Our staff, like the entire healthcare system, has been under immense pressure over the last 16 months. And we do utilize staff who are available for overtime to bring into staff units when we do have sick calls or people who are unable to come to work. We continue to do that. We're also currently evaluating our casual pool or our relief pool of staff and those numbers, and looking at strategies to bring on some additional staff to help us through the next little while of this high call volume time.
Operator, could you please put through our next caller?
Lisa Johnson, Edmonton Journal. Hi, thanks. I just wanted to follow up on some of the previous questions there for Darren. I'm wondering if you can give us an understanding of a better understanding of that staffing pressure that you're under right now. Like, what percentage of EMS staff is currently on stress leave? Can you put a number to that?
Thanks for the question. I actually don't have those numbers with me today. If you want to direct that to communications, we can follow up.
Do you have a follow-up question, Lisa?
Okay, sure. And just in terms of the metrics that Catherine was asking about and what you hope to achieve with this, have you estimated what kind of hours would be saved for paramedics, and then that would presumably free up their time to answer more calls?
No, we haven't calculated what the time savings are going to be. We just know that this is a great opportunity for us to begin this work with Phase 1, knowing that there is going to still continue to be work in Phase 2. We will continue to monitor the offload times metric that Darren talked about, and how Phase 1 improves that metric, and then so we can then begin to look and how that might also be further improved in Phase 2. Thank you.
So we have time for one more question. Operator, please put through our final question.
Bill McFarland, CTV.
Hi there, Minister Sandra. Thanks for taking the question. Yesterday we had a story on a man who said he's experienced discrimination at 2 different points as he tried to get emergency medical care for his unconscious mother. Sunchild First Nation says this has been an ongoing problem for years. They've been in touch with your office on the issue. We'd like to know what you're going to do or what you are doing to address these and other similar complaints.
Well, I understand from AHS they have answered to this. This is, my understanding is not an AHS provider in this situation, that this was a EMS provider, First Nations or Indigenous EMS provider who, in this situation, obviously, this is something that I take seriously. I think something that AHS has said that they're investigating right now with the EMS provider. So I look forward to AHS being able to conclude their investigation into this situation and being able to provide us with information that I'm going to need to understand what happened here and what we can do going forward to make sure that doesn't happen again.
Bill, do you have a follow-up question?
Yeah, I'd just like to push on one piece of this. There was an EMS element, but there was a second element with the hospital. I think Sunchild First Nation says that it's been more issues in the hospitals than with their complaint rather than with that EMS provider. I'm just wondering if there's anything that your office is out doing to look at those issues within hospitals. We've heard similar complaints from other communities.
Yeah, and I have heard that as well. So a couple of things that we began work on beginning in 2020. Big part of it is making sure that we have a bigger voice for public members, regular Albertans, in being able to have a voice at the table when it comes to seats at the college table or on the hearing tribunals, remembering that our 30 colleges are self-regulating our health profession. So there's 30 of these colleges. Obviously, the most significant are going to be CARNA, the Registered Nurses one, the LPN one, as well as the CPSA, the College for Physicians and Surgeons. And making sure that by having more public members and having it 50-50, then those Albertans can bring those concerns to the table and bringing their voices to the table, making sure that it's not just regulation of clinical decisions, but also regulation of professional decisions and whether there's unprofessional conduct that happens in any clinical setting, whether it's in a hospital or otherwise. So that's one step. The other was in 2020 beginning work. When we heard concerns in one particular hospital in the province, beginning work with AHS, we contracted out to do a review of what they call in AHS the medical staff bylaws. This is the set of bylaws that determines when and how a physician gets privileges in an AHS facility. Because we have to remember, doctors aren't employees of AHS, and so how they get privileges and how privileges might be taken away, that process is governed by the medical staff bylaws. We've now received that report. It takes a long time for changes to the medical staff bylaws to be ratified. They're going through that process now, and the profession is I understand, reviewing the proposed changes. And there's recommendations related to, they call the Vanderbilt model, so how discipline is done in a progressive way in the hospital system. I understand a lot of good feedback has been received by the medical profession and how those changes might be done. So that's another step as well. As when it comes to an Indigenous patient in Alberta having concerns with the care that they get, improving the patient's complaint process. Oftentimes, I've heard ever since I've come into this role that the patient complaint process is difficult to navigate for any Albertan. We have so many different professions and so many different colleges. We've asked the Health Quality Council of Alberta to do a review of that process and seeing how we can help patients navigate that system. And so we're looking forward to being able to receive that review from the Health Quality Council so that we can work together in improving that system. I think when we get that report, there's going to be recommendations on how we can improve also the patient's complaint process for Indigenous patients and making sure that, because I've also heard that a lot of Indigenous patients aren't actually even reporting concerns that they have. So a big part of it is actually making sure we have the data that we need to be able to see the concern as a whole. So I'm looking forward. I know that's a lot of information, but it's a big problem, and it takes a lot of work. And so some of the work that we've already started going back to 2019, and that we're going to continue to work forward on. Thanks, Bill.
That concludes today's availability.
Oh, great.
Thank you for joining us.
Thank you.